Then again, yeah, it's terrific to be with you, even digitally, and I hope next time face to face, it would be even much better. But I'm really delighted to be invited, and thanks for Lasse and the entire organizing team. And yeah, let's get started. European networks fostering cross-country collaborations. And if I can move my slides. Then we need to talk, of course, about the EOSC Association, who has just recently been formed as a legal entity to govern the European Open Science Cloud and is creating an ecosystem in a series of funded projects and initiatives from member states and associated countries. Before EOSC was formed and coming to our horizon, we had the life science research infrastructures already in place, and currently these are 13 European life science research infrastructures working together to provide access to world-class facilities, samples, instruments, services, and data. And last but not the least, we have also the ERIC Forum, which is more a forum of those research infrastructures who have been granted a specific status by the EU Commission as an ERIC. And BBMRI is currently coordinating this ERIC Forum in order to create also a strong research infrastructure ecosystem. And maybe specific alliance is EUAMRI, which is the Alliance of Medical Research Infrastructures, where EATRIS, ECRIN, and BBMRI ERIC are working together to use as much synergies in providing services to the research community. And probably for no surprise for you, I will talk specifically about BBMRI ERIC as an example of a pan-European research infrastructure. And for those of you who are not familiar with BBMRI ERIC, this abbreviation stands for Biobanking and Biomolecular Resources Research Infrastructure, a difficult name, and has been really acknowledged as a European Research Infrastructure Consortium by the EU Commission in 2013. Now, what are we really? So we are a life science research infrastructure built up on currently 17 member states, and you see them here on the left side listed and highlighted in dark blue, and 6 observers who are constituting our pan-distributed research infrastructure. But it also means that in each of these member and observer states, we have national nodes. So altogether, we are cooperating with 23 national nodes, and they have behind themselves the biobank network. So we have about 700 biobanks adhering to it. We have 3 expert centers and 1 headquarter located in Graz, from where I'm now giving this presentation. And beyond all these biobanks and national nodes, we have several affiliated partners. So this all comprises BBMRI ERIC as a pan-distributed research infrastructure. Now, our mission is to establish, operate, and develop a pan-European distributed research infrastructure of biobanks and biomolecular resources to facilitate the access to resources as well as facilities, and to support high-quality biomolecular and medical research. And I will dive a little bit into more detail in the next slides to come. So if you talk about biobanking, you have done this already during these last 1.5 days specifically, but maybe it's fine to highlight this still, that we have different biobank types, from whole-scale integrated or population-based biobanking up to museum biobanking. And all these different biobank types really need to adhere to distinct requirements, be it biospecimen science, quality management, cryobiology technology, IT infrastructure, up to equipment and ELSI issues. And all these tasks, that's where we try to harmonize, standardize, and support across our network. And if we talk about biobanks in BBMRI ERIC, it's fair to lift out that 70% of our biobanks are healthcare integrated biobanks, about 25% population-based biobanks, and then also a few human biomonitoring, et cetera, and there are only individual examples of other biobank types. So the majority really in BBMRI network are the hospital integrated biobanks, and how we try to support them, enable the use of samples and data and biological resources, I will dive into a little bit further. So for a long time, and also I think still nowadays in some instances, we have on the one side the clinical care, and on the other side we have translational research. And it's difficult if nobody watched how the samples and data come from one side to the other. So the pre-analytical bias is still an issue in many instances, and this structural gap this can and has been closed by hospital-integrated central biobanks. And they care about from patient recruitment over sample collection, sample processing, via sample storage, up to biomaterial request forms. And if locally, then you use a very strong biobank information system, short BIMS, then this becomes quite a powerful tool, and we can then also not only manage the samples, but also adhere the clinical data, capture follow-up data, and even take back research data. And if you regard this not only as a one-way street to enable research, but also feed the results back into the clinical field, then this really can become a strong feedback loop. And I think this really then enables precision medicine, where this system can then support clinical trials, molecular tumor boards, patient engagement, and citizen engagement. And most importantly is that the samples are, of course, of high importance, and I will come back to this in a few seconds, but the data are gaining more and more importance, as we all know, and therefore the modern health-integrated biobanks with powerful IT tools become even more data integration centers. Now, if you look at this is locally set up, this is already fantastic for everyone working in the healthcare sector or in the research field on that side. But what if we can connect these instrumentations across locations within the country and then even across nations? And I think for this aspect, it's super important to realize that it makes most sense if these processes are quality certified. And this is also an aspect that we heavily support. Now, enabling precision medicine across our network is built up on certain research and services pillars or development pillars. And one of them is the ELSI one, which is knowledge-based help desk, ethics check training, and code of conduct for health research. We have public affairs and stakeholder engagement, a strong IT service and research pillar, and as I pointed out, the quality management services and research. And these are very heavy pillars, and I will only give a few examples how they assemble basically our service and provision pipeline across our member and observer states. Now, starting with ELSI services and research, so key topics are really quality of life, artificial intelligence, GDPR compliance, and incidental findings. And we have here 3 domains where we are involved in research projects, but we have a very strong service domain here with an ELSI help desk and ELSI knowledge base, which are open access resource platforms and accessible for everyone if there are any questions according to it. We have also a strong training domain here. And now recently, we have even focused more and more on the development of a code of conduct for GDPR, as we still, I think, all realize in the daily routine that GDPR is helpful, but still sometimes difficult to interpret and to apply in the best possible way forward. Now, of course, without a consent, and this is also where ELSI is caring about, without a consent, we are not able to use any kind of data or samples. And an ideal consent probably doesn't exist, or is at least not harmonized across Europe or globally. But I think setting certain standards and having certain incentives for the use of samples and data in national and international projects for academia and industry is important. And if this, as is depicted here, is in close link of the hospital-integrated biobanks with the hospital information system and digitally aligned, then one can have in the biobank information system locally even the phenotype of the samples or of the clinical data according to the samples in real life almost. And this would also then allow for automated patient recruitment for any kind of study projects. Now, the biobanks in our network, they are really caring about the entire patient path from prevention, screening, detection, treatment, systems medicine, therapy prediction, prognosis, therapy monitoring, surveillance. And we are focusing mainly on 3 disease entities currently, which is cancer, rare diseases, and COVID. But the biobanks, of course, depending on the request and their setting locally, nationally, also care about any other diseases. And as outlined before, it's all about the samples and data, or more and more the data and the samples. And we all know that in the routine diagnostics field, the biomarkers which are looked at are quite stable. But this is, of course, a different story towards precision medicine, where downstream analyses are becoming more and more complex, and where it's just too difficult for the clinicians to overlook how the specific sample should be collected or pre-processed for very specific downstream analysis. And we know that the more methods we are having in our hands, the more complex it will get. And so it's actually still not a wonder that the pre-analytical phase accounts for a huge amount of clinical laboratory errors. And if we then look actually how much money is burned in basically research which is spent on samples which are having questionable quality, this is something still alarming, and where we need to work together to overcome these barriers and to invest the money wisely in high quality samples and data to start with. And therefore, we have a very strong quality pillar in BBMRI with a knowledge hub, where we are working together with international standard developments, where we are also working in projects to provide QM services, but also where we help the community to tackle current challenges and future challenges. We have also training and support domain here, where we focus on pre-analytics and the new ISO norm and biobanking. And our auditing system allows the biobanks to self-assess where they are standing, either for the entire biobank or for specific cohorts. And if they use the self-assessment tools and feel that they're ready, then we can come in with our experts across the entire network and do an audit. And if the audit goes fine and positive, then their biobank or their cohort is allowed to receive a quality mark in our directory. What the directory is, I will outline in the next slides. An additional task that we have started, feeling that liquid biopsies is becoming more and more important, especially for precision medicine, is the task force on quality assurance, where we look further into not only monitor the processes, but define quality markers, extrinsic or intrinsic, to allow the assessment of the quality of samples, which will make sharing of comparable quality samples even easier and enable this. Now, I talked about the directory, and the directory is really where we highlight which biobanks in our network would be able to provide samples and data as such. But here are also listed cohorts of specific diseases or studies. And currently we have about 700 biobanks and an estimated number of 100 million samples and associated data. We facilitate accessing those through different tools, and its entire path from discovery of requesting, exchanging, and then capturing the results of it. And the tools that we have developed with our IT domain are really the directory itself, which is on a high granular level, whereas the locator and finder tools are more on a deeper granular level on individual sample and data level. And then if a requester has identified certain samples or data of interest, then this is entered into negotiator, where it's matchmaking between the requester and the respective biobanks who could provide these samples and data. This is also in accordance with access policies, and if necessary and requested with an ethics check adhered to. And then in the end, we also not only support the MTA and DTA, but also then capturing the data back for the biobank. Normally, this entire path is for the biobanks in our member and observer states, but there are two exceptions. And I think this is also important for you to know, that the directory is open for any biobank to visualize COVID or rare disease samples and data for use. And this goes basically globally. And the next screenshot just shows you that the COVID-19 samples and data in our directory currently really capture from North America or Canada up to Australia, different biobanks, bringing the cohorts together for the benefit of the research in this field. This accessibility is, of course, only doable through certain tools which have been developed time by time and are now more and more becoming integrated into this entire pipeline. And foremost, this BBMRI directory, where we highlight specific cohorts, but overall you can look for all different kinds of diseases in the biobanks. Then the locator tool and the negotiator tool, But if you're using it the first time, it might be overwhelming. So please be ensured that we would be really happy to help you with our help desk, which you can use to contact us. Now, all this is only possible through a very strong and rich IT domain, and I don't want to go into very detail here what all the different domains are capturing right now, but all our endeavors are crystallizing for a more and more maturing BBMRI federated search and analysis platform. And this platform will be further developed and grow, and has become already the central focus point or contact point for our activities within the EOSC, within the European Health Data Space, and also understanding cancer and any other initiatives on the European or even national levels with our collaborators and partners. And speaking about those ones, we wouldn't be there where we are right now if we wouldn't have a very strong stakeholder forum with 3 pillars: the patients and the public, the industry and the scientific societies, where we have very strong collaborators and partners, not only actively being involved in our activities, but where we also listen to and where they are particularly having a seat in our advisory board. And if you feel that you would belong to one of these groups or any group that I approached, please get in contact with us. Now, on the research education level, I think it's important to outline also that we have our annual conference together with ESBB in the EU Biobank Week. Every year we have, every second year, the International Biobank Conference Qatar, which we support together with ISPER, and this is organized by Qatar Foundation and ESBB. And we have started this year an international IT symposium also together with ESBB, as we feel that the datafication processes are becoming much more important for the biobank field. Of course, there are additional symposia and workshops if and when needed or requested. Overall, our training courses and workshops have been more formalized and crystallized now in an overarching BBMRI Academy with CME accredited e-learning courses. So if this is something of interest for you, I welcome you to look at our homepage and to see what's upcoming. Now, all these activities cannot be only performed by a headquarter team. So the headquarter in Graz is, of course, capturing and representing certain domains, as I outlined, but it's only working through very intense community engagement. So only working with our national nodes, with the biobanks, with the partners of the biobanks, this brings the richness and the expertise at a broad scale across our member states and observers. And this is just a capture of the actively ongoing task forces, expert and working groups, where basically whoever is interested in our community, in the members and observer states, is aligned and working together. And this drives really this community forward and makes these developments possible. And these are also of course, the ground where we come together and act on EU calls. And at the moment, we are in the luxury position to be involved in 22 EU-funded projects together with our partners, which fuel into our core budget, which is perceived by our members and observers in order to align these core activities with project-funded activities. And as I said, if you're interested and have any questions or would like to closer work with us, this is a headquarter team, which is very much looking forward to get in contact with you and is there for any questions. So I hope I didn't overspend my time, but I think it should be just in time. I hope you could get some information that you weren't aware of before, and I'm happy to take any question or also be in contact with you bilaterally afterwards. Thank you so much for your attention.